Thank you all for coming. My name is Daniel King, and today I will be discussing with you our new educational plan to utilize technology to enhance patient care. I will cover 7 main areas, explaining how technology improves patient outcomes, objectives for the education plan, instructional methods, resources and support options, the timeline for the educational plan, recruitment communication and contingency plan, and finally, I will discuss how the education plan will be evaluated. I will cover how technology can be used to impact patient outcomes for the better. Not only helps in the hospital setting, but in the educational setting as well, helping to provide nurses and future nurses with better training and allowing them to better prepare for working in a hospital environment. Technology can also improve communication abilities through secure message systems and notes found within the electronic health records, or EHR. Certain technologies can work within EHRs to recognize changes in patient status and recommend treatment options. Basic safety checks, such as medication scanning, also help to improve patient safety. Overall, technology helps to enable more timely, personalized, and efficient care through tools such as digital communication, data sharing, and clinical decision support systems. These systems and new technology help to reshape patient engagement and healthcare delivery for the better. The educational objectives for the course. Objectives for students will include identify key technological tools involved in improving patient care, explain how various technologies enhance communication, patient monitoring, and decision making, demonstrate how to properly use healthcare technology, and evaluate their technology use and how it can be improved upon if applicable. To be considered, the objectives must be met by the end of the course. In this slide, I will discuss the instructional methods and educational tools which will be implemented to promote learning and information retention. Quizzes and tests will be used to assess students' knowledge and understanding at various points during the course, due to their simplicity and effectiveness at gathering basic data. Videos and live webinars will be used to provide instruction to students and allow them to refer to should they require further education or wish to review the material. E-learning modules will provide practice work based on that week's curriculum and learning objective and allow students to learn at a relatively personalized pace. Virtual patient simulations will also be conducted to provide students with a sense of familiarity of the hospital setting and help them gain skills using technology such as EHRs to document and care for patients. In addition to those previously listed, games will be integrated into the learning curriculum. Studies show that modifying games to become educational can help to improve student interaction, motivation, and knowledge retention. The slide discusses the resources and support options that will be utilized. Have access to pre-recorded videos containing information regarding the content being taught that week. They will also use e-learning modules, which allows them to access information at a relatively personalized pace, apart from due dates. To aid in the implementation and improvement of the education plan, we will utilize our IT staff for assistance in technological areas. We will also use Google Forms to conduct our surveys and make use of a learning management system, which is a software system that will help to organize online learning for our students. The timeline for the educational plan will be as follows. Of course, the objectives for the learning will be set. New teaching tools will be explained, but traditional tools will be primarily utilized. Halfway through the course, students will be evaluated on learning skills and provide feedback on their thought of the course so far. New teaching methods and tools will be fully implemented at this point. At the end of the course, students will be reevaluated and provide feedback on the second half of the course. Gain applicants and spread word of our program, we will utilize the following recruitment methods. Recruitment of new students, we will utilize tools such as social media and online advertisements. Social media can be a cost-effective way to advertise our new educational program and spread awareness of the courses we offer. Online advertisements, such as ads on YouTube, also do well at spreading awareness, especially for nursing students who watch videos regarding clinical procedure and lessons. We will also communicate with our local community college to offer concurrent enrollment for nursing students who wish to get a head start on their continued education. We will also offer scholarship programs to get more people interested and spread word of our program, while being sure to emphasize our program being online so that possible students understand how accessible it is. Should a problem arise in the program, we will communicate using the school's emails given during admission. The success of the educational plan will be evaluated based on the following factors. Test scores will be used to assess for improvement in the learned knowledge of the students. Multiple surveys will be conducted in which teachers and students can state their satisfaction with the new educational plan and leave recommendations for improvement. Finally, acceptance rates will be compared to graduation rates to determine if the new education plan is effective at educating students and providing them with the proper tools necessary to graduate and be successful in their work. That is it. Thank you all for coming and have a fantastic day. I will now answer any questions you have.